Welcome to the Dr. Ferrer podcast, hosted by pulmonologist and author Dr. Gustavo Ferrer and me, Amanda Ferrer. Welcome back to the Dr. Ferrer podcast, a podcast about living longer, aging better, and finding peace one breath at a time. I'm Amanda.
I'm Dr. Gustavo Ferrer.
And today, if you feel tired all the time and you can't explain it, this episode is for you. It's 2 parts to our holiday sleep series, and we're so glad you're here.
That's exactly right. When your sleep gets multiple times interrupted during the night, your body, your brain are not getting the restoration that they need, and that actually affects the entire physiology. And when
Right.
you get to understand what's going on and what happened in the entire process, which is what we're going to be doing today, you may have the opportunity to take actions, and you will have the opportunity to help yourself solve those issues.
Yeah, and I mean, so many people, including me, wake up like very tired, and I blame myself. I either went to bed too late, I was like last time we spoke about watching the screen, or they're too stressed, I'm too stressed, or just like a bad sleeper. Sometimes I don't deal with that. I know other people that deal with knowing that they're a bad sleeper. But I mean, that's also a thing. Either like last time we spoke about the ecosystem, preparing yourself. But from knowing you and our conversations that we always have, I mean, the problem isn't you. It's just what's going on more inside your body when you sleep, right?
That's exactly right. I'm going to say that there is no one that is a bad sleeper. It is not understanding the physiology, the things that is happening in you that are
Mm-hmm.
responsible for the sleep issues
Right.
that anybody has.
Mm-hmm.
It's such a common problem. And a study just recently published a couple of months ago by JAMA, a very prestigious journal, they look about 11 million veterans, and they found that people with sleep apnea,
Mm-hmm.
interruption during the night of sleep due to the sleep apnea, they have almost double the risk of developing Parkinson. In Because the brain does not get enough oxygen during those episodes of apnea,
Yeah.
and that produces significant constant stress, and the brain does not get the to repair at night, and that
Wow.
stresses generate significant risk for developing Parkinson.
Wow. Okay. And these were like older veterans, I'm assuming, or was it?
Not really. Sleep apnea today is affecting at all ages. We have
Oh.
multiple studies that shows that even kids are developing significant sleep
Whoa.
apnea, and not only that, there's also a recent very interesting study that look at a large number of patients by
Mm-hmm.
Marshall University, and they found that people with a sleep apnea, they have accelerated aging internal of cells. The cells are getting older faster than people without a sleep apnea. Because again, the lack of oxygen at night that gets interrupted so many times
Mm-hmm.
is responsible for producing stressors. And that's the reason people
Oh.
feel so foggy, tired, fatigue during the day, the next day, because they couldn't have a reparative sleep.
Ah. Wow. Okay. So is that, I mean, that's not one of the only things, right? Sleep apnea is just one of
It's
many.
It's one of the
Yeah.
many reasons for sleep disturbances. The problem is the frequency of sleep apnea has grown tremendously, and there are recent study also just last October, the European Respiratory Society, they scientists in during that congress, they
Mm-hmm.
presented data that they found that even a small pollution increases the number of people having apneas at night. Just a small amount of pollution. So
Like
people live in
environmental outside or in the home?
uh, outside predominantly. That's what they measure. They look into areas where they have high population, big cities,
Ah.
car pollution, but just a small amount of that can affect the entire
Wow.
environment and produce higher number of people or higher number of events,
Hmm.
apneas events at night. So
Wow. That's crazy. I mean, so if you don't struggle with sleep apnea, what is something else based off of your research, based off of what you know, that can like be causing no sleep or horrible sleep?
So let's dive into that and let's define what a sleep apnea is, so
Yes,
that most
first that.
people understand what's going on.
Mhm.
We will focus on a sleep apnea because it's the biggest physiological phenomenon that is affecting the largest number of people. But sleep can be interrupted not only by the apneas, but can be interrupted by snoring. Snoring is part of the process that people develop sleep apnea, and we're going to go into that in a minute. But also, the things that we spoke in prior episode related to behavioral issues.
Pre-sleep. Yeah.
Correct. So in here, we're going to be diving into the physiological, the things that have to do with issues that are happening during the sleep.
Mhm.
So there, we put a simple weight in two groups. There is issues related to snoring, and there are
Mhm.
issues related to actual apneas. But apneas, they are usually having significant amount of snoring. Mm.
So have if you snore, you may have sleep apnea.
If you snore, you may have a sleep apnea. And even if you do not have a sleep apnea
You can
and you
still snore.
snore, the snoring can interrupt your sleep and also lower your
Oh.
oxygen and produce the same stressors that we're discussing here.
Oh, okay. So then when does snoring become sleep apnea?
That is an interesting question. So you can have snoring
Mhm.
that can have multiple reasons. The number one reason for snoring is because there is a muscle, big muscle behind the tongue, that
Mhm.
when we fall to sleep and we go into deeper part of a sleep and the body goes in total relaxation, that muscle tend to collapse the windpipe. So the oxygen is not flowing through, and because air and oxygen are not flowing to the lungs, so that
Wow.
narrow space produces the sound
The
that we
sound.
hear. It's like breathing through a straw. So you snore,
Oh.
but you still have some oxygen going
Right.
in. So many reasons that we will talk in a minute, but apnea is actually total collapse of that posterior part.
Oh.
So there is actually no oxygen going in. So those really severe episodes of apnea, people stop breathing. And when they stop
Oh.
breathing is because the air, the back of the tongue has collapsed, cover the windpipe. Oxygen is not flowing through. And that lack of oxygen produces all the physiological changes that are being described.
Wow. Okay. Okay. That's crazy. I didn't know it fully collapsed. I thought it was just like a struggling of air. And I know and I've heard that it's sometimes snoring at least, not sleep apnea. I don't really know that much and we'll know more today. But with snoring, it was always either and coming from you, either lack of exercise, which yes, is probably true. Um and that leading into weight, but also in like the position that you sleep. Because I feel like when other people are snoring, that I've heard, they're like laying on their back. So it's more likely that that muscle will collapse because of the gravity,
That's exactly
right?
right. That's exactly right. But if we span this phenomenon,
Mm-hmm.
we're going to find that, yeah, it is true. There is a correlation between sleep apnea and obesity. But it's not a one-to-one correlation that
Right.
if you're obese, you will develop sleep apnea. Because although we know that when people are losing or lose a significant amount of weight, the sleep apnea will get better,
Right.
but there's many instances that you can go back to your normal weight and it will not disappear. So there is a
Really?
little bit more than just weight related issues. There are issues
Mm.
related to the muscle tone that you are mentioning.
Mhm.
Obviously, sleep position um, is 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 very much a good factor influencing the frequency of apneas. We know that people that have a sleep apnea, they sleep facing up, upright position. They tend to have more apneas. An interesting fact: when sleep apnea became a treatable condition back in the 1980s and all the way until recently, part of the treatment for many patients with mild sleep apnea
Mhm.
was actually a belt that has a tiny bulge in the back, so that when people roll through their back and they felt that thing, they will turn to the side.
Oh.
So that was part of, when we didn't have all the things that we
Yeah,
have
yeah,
today.
yeah. Wow. Wow. I mean, that's no tech. It's just a belt with a ball.
A belt
Wow.
with a ball. But at the end, it's a practice that has been abandoned for many reasons. But one of them is that actually interrupt the sleep even more. For
Exactly.
so you
It
you
does.
get lower back pain and many other things related to that.
I didn't think of that.
Yeah.
Wow. Yeah. I mean, so with sleep apnea, this is something that you said could be treated? Is this like but even if it's treated, you still have it? I didn't fully
Even if you
understand.
if you treat it, so let's go over interventions or
Okay.
things that you can do,
Mhm.
and we're going to expand that in our next episode. But the
Mhm.
most fundamental part of this is that um, we first need to understand that they're not bad sleeper. There are not people that, I'm a light sleeper. Anybody having those kind of symptoms, I think the first thing that they need to do is to really contact a doctor. Earlier on, you asked, is that an age related problem?
Mhm.
And the answer to that is not. By the way, the largest group of people with sleep apnea are people in their 30s to their 60s. The
Ooh.
largest population that we have today with sleep apnea during the most productive years of their life,
Yeah.
they're having a significant interruption in their sleep. The oxygen is not flowing. And we have this year MRI studies that they
Mhm.
looked into the brain, and the cells in the brain, they tend to look older, they tend to behave older when compared with people that do not have a sleep related disorder or sleep apnea. So, and we call it sleep related disorder because there are so many
So
other
many.
things.
Yeah. Yeah.
And that's the reason the number one recommendation will be to have a proper sleep study done. So, the study today can be done at home. There are very simple system that would allow you to sleep normally and see your patterns. We even have in our watches
I've
um,
seen that, yeah. But
sleep
I feel
patterns.
like I tried to do that and it's like more annoying to have a watch on me. A big Apple Watch. I've heard
True,
like the Aura ring, like a ring that monitors your sleep too
true.
is a little smaller. But I like sometimes sleep with my hand like around my face or like and it like is very bothersome. So I feel like that's more
It is, it is.
obstructive at that point. But I mean, how else do you do a study without having stuff on you?
Well, there are little machines today as simple as putting wrapping up in your finger and you go to sleep, and
Really?
you can see all the stages and you can check your oxygen just by wrapping a little tiny thing in your finger. So there are many options. So that
Yeah.
shouldn't be a reason for anybody not to go and seek medical attention
Right.
to look into this. So number one, there is a solution has to be tested.
Mhm.
Number two is not an age per se phenomenon. It can
Mhm.
happen at any age, even in children. It's very common. Obviously, obesity is a factor, but also
Right.
kids with big tonsils, they can have
Oh.
snoring and they can have sleep
Is that why they
interruption.
get them removed?
Historically, that's what was done. And sometimes the proper intervention in children is to do the surgery and remove the tonsils, and the phenomenon, the sleep apnea, can actually disappear in many instances.
Mm.
So, but obviously that require a proper evaluation
Right.
by a doctor so that they go into the appropriate diagnosis, the
Mhm.
severity of the apnea, because the sleep apnea, we classify this in three groups. Mild sleep apnea is when people have, roughly speaking, between 5 and 15 episodes of sleep interruption apneas where the windpipe get
Fully
closed.
closes, yeah.
Yes, per hour. Between 15 and 30, we call that moderate
Medium.
sleep apnea, and severe is
Mm.
greater than 30. I have seen people having 70,
Ah,
more apneas than seconds, because they have multitude of events. I have seen people having apneas close to 1 minute, meaning like going underwater and holding your
what?
breath. So that is an apnea. You hold your breath right now. That's an apnea episode, meaning no breathing. So there are people that can go, the most common number is usually 20, 30 seconds
Without
um,
breathing?
without breathing. Mhm.
Oh.
Until the amount of oxygen drops so low, and the body is signaling you got to
Right.
wake up or you got to do something, that the
That
apnea comes up. And, many bed partners can witness those apneas and mention to the patients or the person. But for the most part, which is the most intriguing and complicated part of this,
mhm.
is that this multitude of events are happening at night without the person knowing
The
that.
person themselves, yeah, because 'cause you're
Yeah,
so far into REM sleep.
deep in your sleep,
Yeah.
or not so deep, because those interruptions are not
I
allowing
guess,
your
yeah.
brain to repair and go
Fully
into
go to
deepest
sleep.
part of sleep. But what happens is that um, the cues, the signals
Mhm.
that you get the next day are the one that we're not paying attention to. We're not paying attention when we feel foggy, when we feel tired,
Mhm.
when we have lack of concentration.
Mhm.
Mhm. We're not able to focus on a task, or we're sleeping through the day, or in the most severe cases, there are patients that fall asleep um, um, driving, or in a traffic light. This is a common question that we ask our patient. Do you fall asleep watching TV early in the afternoon, or you fall asleep
Oh.
driving or in a traffic light? The most severe cases, people can
Catching
have,
up on their sleep.
and it becomes a problem because
Right.
today, for example, it is mandated that pilots in commercial airlines and private too, they need to, if they have signs and symptoms that are indicative of potential sleep apnea, they need to be tested, because it was a very big phenomenon in commercial pilots flying across
Yeah.
long distance, and they get tired, they
Fall
fall
asleep.
asleep. It's a monotonous job.
Yeah.
And also people operating heavy machines in
I didn't even think of that.
they fall asleep, and
Right.
and half of the building falls down. So
Oy, oy, oy.
unfortunately, those kind of events have been described, those kind of phenomenons, you can find it online. And today there's a strong recommendation for people that have risk factors and symptoms of a sleep apnea to be tested if they are going to be operating heavy machines,
Right.
or
Makes sense.
they're going to be flying an airplane with
Mhm.
500 people. So
Hi.
it is
Yeah.
extremely important to pay attention to the subtle cues that we tend to blame ourselves. And the reality is that we're not understanding the physiological changes that are happening in our body that are sending a
Signal.
signal, a
Yeah.
message.
Because, like, I'm just thinking of me when I sleep, like, I'm alone. How would I know if something like that has happened to me? You know? Unless, like, I put up a camera or, like, because I can wake up in the middle of the night and be like, okay, did I wake up because I want water? Do I have to go pee? Am I hot? Or was I snoring that it woke me up? I don't think I snore. I've heard that other people tell me I don't really snore. Sometimes I snore. Sometimes I talk in my sleep. That wakes other people up, wakes me up sometimes. But how do you know that, like, if you go to the doctor and then it's like, oh no, you just were dehydrated in the middle of the night? It wasn't because,
So the first thing is that we all are entitled of having bad night of sleep.
right.
If you go to a party and you get home late
Mm-hmm.
and you have drank alcohol can make the apneas worse, but also can interrupt the sleep in different
That is
ways.
true.
So you're entitled of having a night or few nights that
Yeah.
are not your pattern of sleep.
Yeah. Once it
That doesn't
becomes
shall become, or this will not become something that you're gonna run to the doctor and ask question or question yourself.
right, right, right.
But if you see a consistent pattern that even when you sleep on your own and you don't have anybody telling you that you're snore or
Mm-hmm.
anything like that, the cues are fatigue, sleepiness
Mm-hmm.
during the day, tiredness, lack of concentration, fogginess. All of that
The
are
aftermath.
exactly little signs that are telling you
Mm-hmm.
that there's something not happening at night, meaning you are not having a full repair at night. And the body is signaling through the day that the brain is tired, your cells are tired, your body is tired.
Mm-hmm.
Because sleep apnea or sleep disorders of breathing, um, this phenomenon that end up in low oxygen will be
Mm-hmm.
affecting every organ, will be affecting your brain, will be
That's
affecting your
crazy.
heart, will be affecting your
Yeah.
skin, will
Cool.
be affecting every single organ because we need sleep to repair
Mm-hmm.
the stressors of the day,
Recharging.
recharging.
Recharging for the night. Yeah. And I feel like now with all of this, I feel like now we can more understand how breathing and sleeping correct and how it all affects your body all at once as a whole ecosystem. I feel like now it kind of makes sense for me and I hope for everyone out there. Um and with all of this knowledge, I feel like now I can apply this and kind of be more mindful of either tracking it or when I do notice these things, maybe write it down and make sure that it's not a consistent thing, or if it is, see you. But if this episode helped you understand why you may be waking up tired or what could be happening at night, subscribe and share this with someone who struggles with their sleep too. This may help them.
Absolutely. And I would say that in especially the Hispanic culture, we tend to believe that many things are normally
Mhm.
related to aging. Is the aging process that people snore. The snoring is part of normal life and probably the apneas. And we tend to normalize
Mhm.
problems that are brewing inside of us, and
Yes.
we tend to go way too late to seek medical attention. We wait too long to
Mhm.
actually begin to have subtle changes that can impact your sleep today. So in the next episode we're going to be talking about those things. We're going to go into things that we're going to be able to do today. You don't have to wait until you see your doctor. You don't have to wait until they do the sleep study to
Yep.
begin to make changes that will be impacting whether you have a sleep apnea or not. So please subscribe, pass it
Yes.
on, and be part of this conversation. So we want to help you have a better life, breathe better, one breath at a time.
Thank you.
Thank you.